morning everybody. I am presenting algorithm of cyanosis. Now cyanosis can be of cyanosis is defined as Lewis discoloration due to increased amount of deoxygenated hemoglobin in the capillary blood, which can be either which can be due to either reduced oxygenation of the blood or due to the decreased flow of the blood in the periphery. So it can be central, in which due to decreased perfusion or any other cardiac problem, the oxygenation of the blood is reduced, leading to Lewis discoloration of the blood due to more than 5 milligram reduced. The oxygenation of blood reduced to saturation of the oxygenation is reduced to less than 95% of the blood. So it can be central, peripheral, mixed or differential. Now in the central type of cyanosis, the oxygenation of blood is reduced, due to which there may be Lewis discoloration in the parts where the circulation is comparatively faster, such as tongue, skin and other organs. So in this case the extremities would be warm because the blood flow is not reduced. So extremities would be warm, but the cyanosis can be seen in tongue and other structures. So we can diagnose it as central, about which we will study in the next slide. Similarly, if the extremities are cold due to the blood flow is decreased, so the extremities would be cold in case of peripheral cyanosis, but as the blood flow in tongue and other structures is not reduced, there would be no cyanosis in tongue. But we can see cyanosis in the extremities such as nail beds, earlobes, tip of the nose. Then the peripheral cyanosis, in which the cyanosis is present in the extremities, can present with two types of blood pressures. It can present with reduced blood pressure or normal blood pressure. In the case of low blood pressure, it can be either due to cold exposure thrombophlebitis, or as it is seen in hypovolemic shock, which would also present with diarrhea, vomiting and hemorrhage. And if the patient presents with reduced blood pressure, peripheral cyanosis and precordial pain and perspiration, it can be due to cardiac reasons such as myocardial infarction or cardiogenic shock, in which the cardiac output is reduced, leading to sluggish movement of the blood. Similarly, the patient can also present with peripheral cyanosis with normal blood pressure, which would be due to local arterial constriction as seen in Raynaud's disease, which is a type of cold-induced vasospasm, in which due to the vasospasm the flow of the blood would be sluggish, leading to the peripheral cyanosis in the extremities. Similarly, plethoric phase with normal BP as seen in polycythemia vera. In polycythemia vera, the amount of the oxygen-carrying hemoglobin is increased, due to which the total amount of reduced hemoglobin would also increase. And in case of cyanosis, the percentage or the fraction of the reduced hemoglobin doesn't matter. The total hemoglobin that has been present in the reduced form lead to the bluish hue of the skin or other structures. That's why in the case of polycythemia vera, features similar to cyanosis can be present despite of any disability present in the patient. The patient can be normally walking, but cyanosis can be present in cases of polycythemia vera. Similarly, if the cyanosis is found only in upper limbs or lower limb, it is termed as differential type of cyanosis. In the cases of if the cyanosis is present in the upper limbs, it is mainly due to patent ductal arteriosus with transposition of greater arteries and reversal of shunt. And sometimes the differential, similarly in the case of lower limbs, if patent ductal arteriosus is present with reversal of shunt, the patient can present with the cyanosis of the lower limb. Sometimes cyanosis of lower limb presents with cyanosis of left upper limb, which is mainly due to patent ductal arteriosus with transposition of greater arteries with preductal coaptation of aorta near the subclavian artery, leading to the cyanosis of the left upper limb. Similarly, if we find cold extremities and blue tongue, as we can see that cold extremities is a feature of peripheral cyanosis, and blue tongue, that is cyanosis of tongue, is a feature of central type of cyanosis. So we can call it as mixed cyanosis. In the case of mixed cyanosis, patient can also present with sudden dyspnea, and which is normally seen in cases of acute left ventricular failure. The patient presents with sudden dyspnea, with cold extremities and blue tongue. And if the patient presents with progressive dyspnea, it can mainly be due to mitral stenosis. Now central cyanosis. In the cases of central cyanosis, the patient will present with...
You have done a good attempt. I just want to know from where you have taken this, the first slide.
Sir, PS lab.
Yes, ma'am. See, the problem is just go to the website. What are the usual causes of cyanosis? Which is not here. We are primarily focused on the peripheral causes and the central. Among the central, we are focused primarily on the cardiac causes. So, which broad group is missing here? See, the problem of the
central cyanosis is in the next slide.
This is a small handbook. This is PJ.
And anything beyond this, any other slide afterwards? So anything else apart from respiratory cardiology? That will come into your peripheral cardiology. So any other cause of cyanosis? See, when you deal with cyanosis, first thing which comes to your mind is whether I am dealing with a central cyanosis or a peripheral cyanosis. This is the first question which you need to answer from there. Then if you are sure that you are not dealing with the peripheral causes, which are few causes of peripheral causes like hypothermia, poor exposure, poor perfusion, some local problems, okay, or sometimes normalcy in the first 24 hours. So once you are sure that you are not dealing with peripheral causes, then you focus on central causes. Among the central causes, the two broad groups are either respiratory diseases or cardiac diseases. Okay, but there are two other rare causes which we only think when we are very sure from the history examination that we are not dealing with either respiratory or cardiac. This is the third cause. Methemoglobinemia, all of these are what?
So in the cases of central cyanosis, the patient, if presents with giddiness and we do not find any cardiorespiratory signs, then the most probable reason might be if there is any problem in the blood. So we would go for blood electrophoresis, and we can identify abnormal globins in the blood as in case of HBM disease, and normal globins in which there is presence of abnormal hemoglobins in the blood, such as methemoglobins and sulfamoglobins. In methemoglobin, normally the hemoglobin has ferrous form of iron, but if ferric form of iron is present in hemoglobin, it is termed as methemoglobin, and it leads to reduced capacity of the hemoglobin to carry the oxygen. Similarly, chronic use of certain drugs, this a different type of hemoglobin is formed, which is known as sulfamoglobin, and is a kind of irreversible change in the hemoglobin, which would lead to reduced oxygen carrying capacity of the blood. The drugs included are similar to sulfonylurea and some others. Then, if the patient of central cyanosis, if the donor is found with cardiorespiratory signs, so we can check the effect of the oxygen on the patient. If there is no improvement, the symptoms is more precisely due to any abnormality in the heart, such as if the patient is found with no improvement in on the effect of oxygen, and clubbing is present and single second sound is present, it can be due to Felix tetrad, pulmonary atresia, or right to left shunt. In case of Felix tetrads, there are 4 symptoms present congenitally, which includes right to left shunt, overriding of aorta, pulmonary stenosis, and right ventricular hypertrophy. Similarly, if loud V2 is found in a patient of central cyanosis, there can be Eisenmenger complex, which includes pulmonary vasoconstrictive disorder with right to left shunt. Similarly, any type of primary or secondary pulmonary hypertension would also lead to loud P2 in the case of central cyanosis. If there is improvement on the providing oxygen to the patient, there might be that the patient was dyspneic, which can be due to which can be that the patient developed sudden dyspnea in the course as we can find in his history, and with the sudden dyspnea, which can be due to dry cough, or if the dyspnea is due to dry cough, then it can be due to pneumothorax or any presence of any foreign body in the lungs. Similarly, sudden dyspnea can also present with hemoptysis and related type of chest pain, which is most commonly seen in pulmonary embolism. If the dyspnea was gradual in nature and presents with clubbing, it demonstrates that there can be any kind of chronic disorder, such as clubbing is present but there is no cough and there is gradual dyspnea. It is most commonly seen in cases of interstitial fibrosis. If hemoptysis is present with clubbing and gradual dyspnea, it is most commonly present with bronchogenic carcinoma. And clubbing is present with the gradual dyspnea is present, and it gradually frequently exacerbates and re-emits, then it might be due to COPD. And normal central cyanosis can also be seen on higher altitudes where the oxygen saturation is comparatively reduced. And if gradual dyspnea is also seen after following instrumentation, there would be any collapse of structure which has then occurred due to any kind of instrumentation.